Well, thank you, Dr. Jameson. That was a very provoking discussion. And we'll shift gears now and ask for Dr. Betty Theriault to please come up. And she's been tasked to talk a little bit about the veterinary management challenges when running and maintaining gnotobiotic facilities. She will also have an opportunity to speak about running large cores and keeping them sustainable, I think, a little bit if time permits. Thank you, Betty.
All right, thank you. All right, so yes, that's okay. And that's going forward. All right. So I'd like to thank the organizers for inviting me. It's really, truly an honor to be able to present among such distinguished speakers that we've heard over the last couple of days. With that, we're coming into the home stretch, and just naturally, organically, a lot of what I'm going to talk about is just reframing a lot of the topics and subjects that have been covered by many, if not all of the speakers that we've heard. And so as a laboratory animal veterinarian, I've been asked to speak to some of the veterinary management challenges and future directions in working with these gnotobiotic and germ-free animals, specifically my experiences with mouse models, and then also to provide a little bit of insight into some of the technical considerations for imaging and surgery in these gnotobiotic animals. All right, so a veterinarian is naturally tasked with having to consider many of the challenges that we're faced with as opportunities. There are opportunities for improvising, for imagining how we might extrapolate from one species to another or one situation to another. And I would say that jumping into the germ-free and gnotobiotic environment has certainly put those types of skill sets to challenge for myself. And so with that, what we're faced with, and we've heard quite a bit of, is that we're tasked with trying to develop and grow these germ-free and gnotobiotic programs in the context of almost 20 plus years of developing and refining specific pathogen-free programs. And so that in and of itself creates a lot of challenge. And Tim Han, he spoke very exquisitely to the challenges that we're faced with, just providing education, training, communicating both within and outside of our communities on what these animals are, what their maintenance requires, and some of the challenges that we're being presented with by our research community. So early on, when we were developing our program, I realized that there were three very recurrent mottos that I was faced with, and I repeat often whenever I get a chance to speak publicly, and that is that if this technology were easy, everyone would be doing it. And prior to 2005, there were very few that were still active in the community with these models. And then with the onset of the Human Microbiome Project, what we saw was that there was an incentive for other institutions and other new researchers to the community to want to develop these programs. And so between 2005 and 2010, many institutions started to develop these, and that's where we kind of came into the picture. And then currently, as we're hearing, it's seemingly that everyone would like to develop some level of a gnotobiotic community or program at their institution. And for those of us that have been doing this for quite some time now, we can make this look rather easy. But I would caution that nothing in this technology is as easy as it appears. And because of that, relative to what we're accustomed to with specific pathogen-free or conventional models, everything will take longer than anticipated. So you also have to plan for that. So what we have on this slide is a very typical specific pathogen-free type of housing environment. This is one of our housing rooms. It has individually ventilated cages on ventilated racks. I kind of like to think of these as a human condominium type of unit, but this is designed for mice, where each of these cages creates its own microenvironment. The development of this type of technology over the course of, again, this long history of trying to develop specific pathogen-free colonies is that it helps to protect our mouse colonies, and it also helps to create these individualized environments. Most of our institutions bring in mice. It could be other rodents, but we bring them in from approved vendors. They have known specific pathogen-free status. Alternatively, we bring in animals from our collaborators at other institutions, and many of us will have some form of a quarantine facility. This is a quarantine facility at the University of Chicago. We operate it with a semi-rigid isolator type technology. We've been operating this unit for close to 20 years now, highly successful in identifying adventitious pathogens before they get into our institution, and then being able to either rederive or exclude those colonies from coming in. I'd like to remind the audience that we also, whenever we're receiving any government funds, we are required to adhere to the Public Health Service policy. We're also required to adhere to the guide. If we are involved with any species that are covered under the Animal Welfare Act, such as Jeff Gordon's gnotobiotic pigs, we then have to adhere to that. And that helps to inform how we operate our programs. And then many of us appreciate the outside evaluation of our program by ALAC International. They ensure that we're not only adherent to these policies and guidelines, that we're also adherent to local regulations, or even for the international audience, the international regulations that might apply to those different countries. And so with that, we have this as the background context. In 2006, thanks to Dr. Shervansky, who spoke with us earlier, we were requested to bring gnotobiotic germ-free technology to our campus. The way we did this was taking over a storage room and remodeling it to meet our needs. This first accommodated one researcher. It eventually was able to accommodate with moving into the storage closet next door. 3 of our researchers that had an interest. We have continued to march along this taking over storage units and actually building out a dedicated facility when we had a new facility coming online to not only increase, next slide please, to not only increase our footprint both horizontally, but as you can see in the slide, we've also had to build up vertically as we grow. So the harsh reality is that this technology is ergonomically challenging. The workers have to get very intimate with these bubbles to do the work. This is just a worker that's bringing in materials through the access port. This is labor intensive, and because of it's ergonomically challenging, it's labor intensive, and you're having to do everything manually instead of high throughput and automated like we would have with the ventilator rack system, it's incredibly expensive. And this is not new. Roger Orcutt at the Loban Institute was quoted in 50 Years of Laboratory Animal Science as saying the harsh reality of the relative cost of maintaining gnotobiotes versus the classic approach to an open room soon made it readily apparent that this was not practical, to say nothing of the added inconvenience of having to manipulate animals in cages inside of a plastic bubble. So here we are, blast to the past, and we're recreating these same type of units. Forward, please. So as we've heard, we have our health status monitoring for our adventitious pathogens that we exclude from our specific pathogen-free colonies. There's pretty much general consensus, both from our approved vendors, international standards, the PHLASA guidelines, on the frequency that you want to monitor based on the prevalence of what you're interested in looking for. There's also the classic methodology of live sentinel contact or direct contact live animal monitoring systems. We're now seeing our equipment manufacturers and our commercial laboratories develop new technologies that are allowing us to use PCR-based assays, and also to look at exhaust plenum dust and evaluate what the microbial status of the colonies may be using those new technologies. That has a tremendous opportunity to reduce and refine the number of animals we use to achieve this goal. Historically, many institutions were performing these tests in-house. As these commercial labs became more prominent, we started to outsource these tests to the commercial laboratories. Next slide, please. Next. Now what we're faced with, again, please, is in a sterile environment, advance again. In a sterile environment or in gnotobiotic and germ-free colonies, we're not only faced with monitoring for these adventitious pathogens, but we're also faced with monitoring for sterility. And I have to acknowledge that we are monitoring for bacterial sterility. We don't have the technologies to do high throughput assessment for our trans-kingdom opportunists or those that are integrated within the genome. Forward, please. It's going to go forward a few times. It replicates what I have on the left. So again, we're faced with what's the frequency that we monitor? Oops. What's the methodology? Are we doing cultivation? Are we doing 16S PCR for bacterial populations? And again, who's responsible for doing this? Because this is, again, outside of our normal specific pathogen-free type of monitoring technologies. Forward, please. So in developing and or adapting animal models to microbiome research needs, I would posit that it's not sufficient enough to be able to just house and maintain these animals. You actually have to work with them. You have to conduct the research. Forward, please. So if the purpose of the quarantine practices that we have is to contain potential adventitious pathogens and to prevent them from entering our established colonies, and if the purpose of our standard care practices is to protect the specific pathogen-free status of our established colonies, and further, if the purpose of gnotobiotic practices are the exclusion of all detectable and non-defined organisms, how do we accomplish this in all of the above in the context of germ-free, gnotobiotic, defined flora, specific pathogen-free, biohazardous, wild mice caught on the street, in the pet store, all of these, and they're all thrown together often by the same researcher looking at the same model. So we're incredibly challenged in this regard. And I like to say that every time I say challenge, really hear opportunity, because these are tremendous opportunities for us to overcome these challenges and figure out how we're going to accommodate the research. Forward, please. So again, it's, I believe that part of the answer begins with education, training, communicating. We're having to do that not only outside of our institutions, but also within. We're having to educate our animal care and use program personnel. We're having to potentially educate new individuals that want to join into these types of studies in our research community. We're having to educate our institutional animal care and use committees, our biosafety committees, and program visitors, such as our ALAC site visitors, or it could be, in the case of USDA covered species, maybe even our USDA inspectors. Forward, please. So from a veterinary perspective, many of the interventions that we may want to do with our animals, regardless of whether they're in research or even in a clinical setting, oftentimes will require anesthesia or immobilization just to achieve the objectives of what we want to do. And so some of the things that might apply to is imaging modalities, radiotherapy, if we need to administer test agents, depending on the species and the administration route. If we need to collect specimens from these animal models, could be blood, urine, feces, bronchial alveolar lavage, tissue biopsy, physiological data, to name a few. Forward, please. So from a veterinary perspective, we understand that we work across a broad landscape of species, and these species respond differently to anesthetic agents. And not only species difference, but we also have strain difference, we have breed differences, and this is well known. We also understand that there can be gender difference, age difference, and depending on the physical condition or underlying disease state of the animal, they will also respond differently to these anesthetic and immobilization drugs. Now we superimpose on that complexity the models of germ-free, ex-germ-free, or even humanized microbiome. And my subjective experience in trying to immobilize and anesthetize these particular animal models in the mouse model is that they behave differently than our SPF animals, and they behave differently than our conventional animals. Forward, please. So that then presents some indirect challenges. Again, protocol review. Again, many of our institutions have guidelines that are prepared on what are the anesthetic dose ranges that are recommended for different species. And with that, with these different performance of these models with the anesthetic agents, maybe those guidelines are not sufficient to meet the model. And then we're left with educating our institutional committees that there could actually be a need to stray outside of these guidelines. Again, if we look to literature guidance on dose ranges, so there is a lot in the literature from prior studies that reach back, but some of these anesthetic agents are no longer popular for usage. Oh, thank you very much. Okay, excellent. So some of these agents are no longer in vogue for use, and we may have to mine the literature to find what our current experience is with different agents and different dosing ranges. So one of the things that I strongly advocate when we're reviewing this is, I'm not being able to move forward unless I'm moving the wrong one. Okay, is I advocate that within these different models that we write into our protocols pilot trials for anesthesia doses within the study design, so that before we embark on the research, we actually have an understanding of how these models are going to behave, at least at baseline, to these different anesthetic regimens. Forward, please. So the community, as we've heard over the last 2 days, has been positing the question of, might variations in composition and diversity of the microbiome influence mechanisms of homeostasis both in health and or disease state of the organism? And from a veterinary perspective, it's not so novel. We've heard this also. Might we ask the flip side question of, might the microbiome also influence how the organism responds to different agents dependent on the same mechanisms that might be involved in therapeutic effect? And in fact, we've heard earlier today that plasma levels of different plasma components and also urinary metabolites are going to be different in these gnotobiotic and germ-free animals, or depending on the association. And there's a number of other different pathways that I've listed here. Forward, please. So on the left is just a long laundry list of some of the different, oh, that's a very weak marker, some of the agents that are used commonly in mice and in other laboratory animal species. We also have the inhalant anesthetics, isoflurane and sevoflurane. So some of the things that we're always faced with are the ability to monitor our patients, the ability to interact directly with them, so direct access to these animals, or direct access for intervention during the anesthesia process. Also added into this is now the risk for contamination. And so every time we have a need to interact, we have to consider, are we prepared to do that without contaminating these animals or adding in microbiota that is going to then negate the research study that is of interest. And then our ability to sterilize the support equipment. And here again, this is an opportunity for us to work with our manufacturers to explain and educate to them some of the needs of where their equipment is going to be used. Forward, please. So I won't go into a lot of detail, but again, immobilization for imaging, for treatment interventions. forward please, and also anesthesia, again, for surgical procedures. Forward please. So we have to consider what's the time to induction of these agents. Forward please. The duration of effect. Forward please. Will we need to redose the animal when we're performing the activities? Forward please. And then what's the recovery time? And how long will we have to support the animal during those recovery intervals? Next slide. Sorry, so I can't overemphasize, planning is key. Really having a plan in place on how we're going to interact with all of these. So Sasha and I did not prepare our slide sets at the same time, but we had the same mindset going apparently, because really biocontainment and bioexclusion are flip sides of the same coin. And we've known this for a very long time, and I think that a lot can be garnered from the experiences that we've had for a long period of time in trying to accommodate biocontainment studies. Forward, please. So I really did have quite an honor in being able to attend the Loban Symposium in 2011 that was held to commemorate Philip Trexler's 100th birthday celebration. And for those of you who are not aware of who Philip Trexler is, he developed the first prototype of a flexible film isolator at the Loban Institute. And with that, this technology allowed us to clean up our rodent models. This is the beginning of that. And this is an example of those prototypes. And then if we look over here, and we've seen a few different varieties of the same theme, is that these are our modern flexible film isolators, and they're really not much different. So we're looking at 60 years gone by, and with a few modifications, they're really the same technology. What was really fascinating during a dinner conversation at the symposium was there are a lot of Trexler's contemporaries there from Loban. They were reminiscing about the old times, and one of the things that they reminisced about was a researcher would often approach Trexler and say, here's my test equipment, here's what I want to do, how do I get this inside of this isolator, and how do I sterilize it? And he'd kind of go, well, maybe that's the wrong way of thinking about it. Maybe we should figure out how can I wrap my bubble around the test equipment. And so I think that even right now, we're kind of faced with the same type of conundrum. Forward, please. So we have a number of different procedures that are being requested to be performed in these animal models, and we have equipment challenges on how we're going to be able to achieve those requests. Forward, please. I picked this as an example for imaging modality. So for those of you that are not familiar, this is an optical imaging piece of equipment. It's a Xenogen machine. With that, this technology became very popular about 10, 15 years ago. Most institutions have at least one of these sitting in a core facility somewhere on their campus. And it often, because of the cost of this equipment, is a shared user equipment. And with that, what we have is it comes with a gas anesthesia system where you have an induction chamber. You can anesthetize the mice in the induction chamber. You can then transfer them inside of this magic black box. Inside the box is an anesthesia manifold. You can put up to 5 mice in a little nose cone, keep them anesthetized, and acquire your imaging. And then you can work with your image here on the computer. It doesn't show up really well, but there's a lot of mice that are lined up, and that's how you acquire these images. So it wasn't long after this equipment got to most of our campuses that folks that were doing infectious disease work were interested in also imaging their animals. Well, this is shared user equipment, and we don't want to contaminate it with these biohazardous agents. So what do? Well, an equipment manufacturer came up with one of these containment boxes that allowed to somewhat hermetically seal the mice inside of the box and also deliver gas anesthesia and align with the inside plenum. The other thing you can do is you can chemically immobilize or anesthetize these animals. And that's what's depicted in this box, is that these animals have received an anesthetic dose. They've then been positioned the way that the researcher wants to acquire an image on them. Within this box, they can then be put into this Xenogen unit. The images can be acquired, and you've protected this unit from contamination. So what I pose is that this is biocontainment. It can easily be bioexclusion. What we're left with figuring out is how do we get our sterile animals out of their sterile environment, anesthetize them, have sufficient enough time of duration of effect to transition them from a housing unit to where this equipment lives on our campus. Again, with cost considerations, you potentially cannot afford to have a number of these redundantly placed all over the campus, and then to be able to get these animals back to their housing environment and keep them sterile. And not only do it once, because the real advantage of this type of technology is that not only does it allow for high throughput, it allows for sequential monitoring of these animals in the study. And that's a huge refinement in that instead of having to remove animals at different time points during the experiment, you can monitor these animals longitudinally on how they respond to a different disease process or how they respond to therapeutic interventions. And as far as translation, that's not so different than what we see in the clinical setting of using CT, MRI, PET, or SPECT scans to monitor disease progression and response to therapeutic interventions. So the same type of challenges are faced with the surgical. We skipped a little bit. Okay, with the surgical models. And so on the next slide, what we have is. Okay.
Try that one. It's not pointed at him.
I feel like Goldilocks and the Three Bears. Okay, this is the third one. It should fit well. Okay, so surgical challenges. So what one of our researchers wanted to do was develop their SPF transplantation model into the germ-free animal model setting. And with that, we didn't have a surgical isolator, and we were really wanting to try and be innovative on could we achieve the end goals without a surgical isolator. And I was consulted, as I'm often consulted as being director of this gnotobiotic research animal facility, being a veterinarian, and being somewhat innovative with all of these cross-species and cross-animal model challenges. And so what we were able to do is we were able to, see, I'm not sure where the pointer is, we were able to sterilize the internal environment of biological safety cabinet. All of our facilities have these for the most part. We do have them in our gnotobiotic unit. With that, we then go the extra step of preparing it in a sterile fashion. You see the surgical drapes there. We then had to figure out how we prepare all of our surgical materials to interact with these animals to keep them sterile. We had a well-trained microsurgeon, but now we had to refine her technique so that during the procedure she wasn't disrupting this air curtain too often to create contamination inside that biological safety cabinet. We then had to anesthetize the animals, allow her to do the surgeries, recover the animals, and then get them back to their sterile housing. And so, again, going back to those three mottos to live by, this is not easy. It took a lot of planning. It took a lot of time to get this model off the ground. But with that, we were quite successful. We published this last year as just the baseline of the animal model. And then this researcher has gone on to publish additional studies on how the microbiota does affect the immune system, and then that does affect transplant survival or rejection over time. So to summarize a lot of these points, the challenges that we are faced with is development of our facilities and considering what the researcher needs are within the facility design. And so Tim spoke to this a little bit, and I'll speak to it a little bit more. Understanding as best you can what your researchers are going to be up to in the next year, in the next 5 years, in the next 10 years. And are you in close proximity to the equipment that needs to be used, or do you have the space luxury to bring that equipment into the unit? Also, staffing, training, expertise. I could not support 500% more what Balfour has already articulated. You need folks that are incredibly dedicated to working in these environments. It takes a considerable amount of training. You want to try and limit staff turnover, so you need incentives on keeping those individuals in the unit, having them take ownership of the activities that are in the unit. You also, like Balfour says, you want to bring back what the findings are. The staff love this. They've been a part of that research, and even if it's just the supportive aspect, they really, really then have more value to their daily tasks of what they do. Institutional experience, educating our IACUCs, our IBCs. How can we work with these different agents outside of the traditional environments? Do we really have to have the biohazardous agent in a biohazard room or facility? Or are our isolators sufficient enough to contain these microbes? And I would say that that's dependent upon the risk aversion level of the institution. It's also dependent upon the type of microbes we're discussing. If we're talking our MHB, we do not want that anywhere near our facilities. So biocontainment level 3 seems like it might be appropriate. But if we're talking about a monoculture of what would otherwise be considered a commensal, but the Institutional Biosafety Committee maybe just wants to be particularly cautious about what happens when you have that commensal in a monoculture, then perhaps we can achieve this within our units. Again, educating our veterinarians. What we found, much like that's happening at North Carolina, is that we have a whole new generation of individuals that are coming into this new area that's being developed and expanded more broadly. Individuals need exposure to how these units are operated. We're managing a centrally managed facility that accommodates a very broad user group. So as paying it forward, we've hosted any number of veterinarians or other groups to come in and work alongside our staff to learn the technology, to learn how you operate these units. I was graciously invited to go to Jeff Gordon's lab and to Taconic when we first started. That's where we were back in 2006. With that, we've already discussed health status monitoring, the idea that the microbiome may influence anesthesia and agent metabolism and effect. We've spoken to access to these precious and novel resources. And so there's an incredible amount of expense. There's an incredible amount of startup time in getting these units operating, and that's creating challenges for the broader research community. We've spoken to the financial challenges, not only of building out these specialized units, but the equipment that's involved, the labor that's involved in maintaining these units. And what all of this is creating is an environment of collaborative studies. The research necessitates collaborative studies across institutions and research laboratories. We've seen that over and over and over again in all of the presentations that were discussed over the last 2 days. These also are then creating additional challenges. Let's see, I have control now. Yes, so we're challenging traditional boundaries. And what I mean by that is that with these collaborative studies that are somewhat organically developing just based on the research needs and the need to reach out beyond individual areas of knowledge and expertise and draw in areas of knowledge and expertise from other research labs, what we're faced with is expanding outside of our small institutional communities and going outside of our institutions. And so from a veterinary perspective, what that entails is we're embarking upon more and more memorandums of understanding between institutions, particularly if we are going to transport these animals. Begin part of the study at one institution and then continue with the study at another institution, again, based on either expertise or limited resources. That also requires having material transfer agreements in place to protect intellectual knowledge between the two institutions and those researchers, as well as any type of financial gains that might come from being able to put through a patent or other types of discovery. We have to consider that these facilities are operated at a high cost, and that many of our facilities are subsidized. They're subsidized either by investment by the divisions or by all of the other support that we might have been able to garner for these institutions. And again, Dr. Balfour spoke to this extensively as well. If we're going to transport these animals, then there's the risk of contaminating them during the transport process, not only in taking them out of their unique environments, but putting them in shipping containers and then transporting them by commercial transport means and then receiving at the collaborative institution. Again, education, training, communication. Once they're at the receiving institution, they have to maintain them for whatever period of time it is to get their end part of the study achieved. So this requires training and understanding in sterile technique. And I would tell you that from a veterinary perspective, we're not talking just sterile technique. We're talking psychotic sterile technique. And I've become absolutely certifiable in working with these technologies. And so what I kind of come into the home stretch with is at our institution, we've recently established the Microbiome Center. And what this is a platform to allow our researchers at both the University of Chicago and our affiliate institutions, which is the Marine Biological Lab in Woods Hole, as well as the Argonne National Laboratories, to foster these collaborative research studies. And then not only that, but to try to think outside of our own unique areas of expertise in how the knowledge that other individuals with other areas of expertise might bring into our models to even make them more robust and to expand the areas of knowledge. And so in our institution having a microbiome center, we've heard of other institutions also establishing these. Might we not be in an environment where, much like biocontainment labs or regional primate centers, might we not be in an environment where maybe we need to consider, are there opportunities for centers of expertise and excellence for those of us who are already established, who already are working with these models, or who might have specialized or highly costly equipment or the personnel to operate it, and that might not be readily reproducible from one institution to another. And so again, kind of refining our resources and utilizing what we have. So with that, I've kind of given a really rapid overview of some of the challenges and opportunities, some of the different environments that we've had to traverse at our own institution, as well as working with other institutions. All of this has been prompted by all of the work that's been done by many of our University of Chicago investigators. I've only listed those that have contributed to the challenges that were presented in the models that were discussed during this presentation. With that, I have to acknowledge our Animal Care and Use Program Director, Dr. George Langen. He has been incredibly supportive of our developing the gnotobiotic research animal facility, allowing me to run with it. I've become his most challenging investigator because I'm going in and asking for more, and doing more and more different types of exotic things. I've listed all of the both current and prior animal care technicians that have worked in our facility. Again, these are highly motivated individuals. You can't keep highly motivated, talented individuals locked into your unit for long. They end up moving externally or also promoting up into higher levels of responsibility within the program. I also would like to acknowledge our collaborators. It's because of those efforts of our collaborative studies with the University of Arizona Tucson and also with North Shore Healthcare System that we had the opportunity to engage in these memorandums of understanding, developing MTAs for working with these animal models across institutions, and also being able to consult from a veterinary perspective on how to achieve the desired goals from these research models. So with that, I thank you for your attention, and I'll close at this point.